you have heart disease, you shouldn't be on these. They can cause a lot of adverse side effects. Or NSAIDs, which are also known as non-steroidal anti-inflammatory drugs, where some of them are over-the-counter, some of them are prescription. So tension headaches, usually the NSAID, Tylenol, Motrin. Cluster headaches that I discussed a few slides back, believe it or not, you treat them with oxygen. You hook them up to oxygen, they get better. Also, you can treat them with triptan, intranasal lidocaine because of this ice pick sensation in their nose. The pseudotumor weight loss, this was, remember, the younger obese women get this. And the secondary headaches, which can be caused from the 200 different types of underlying diseases, you treat the underlying disease. So what triggers headaches? One of the most common things is stress. Next slide.
I hope you have a slide in there that has to do with family, because personally that's my...
Family history?
No, my personal family. Oh, like my son right over there.
Yeah, really.
Major cause.
I should have, next time I'll put your picture in this presentation.
Likewise.
So lack of sleep or change in sleep patterns. Caffeine is an interesting one. It can actually alleviate headaches, but it can also cause headaches. Alcohol, particularly red wine. Different cheeses, because they have a chemical called tyrosine. Certain meats, especially the ones that have nitrites, and also a lot of products with MSG in them also can cause headaches.
Now, wouldn't someone be going overboard if they were to eat a hot dog wrapped in bacon? I know that's sort of semi-related, but, you know, how...
I guess I mean, I had that slide because there are two different types of meats
in it.
So
they just happen to be together.
Covered two bases with one picture.
Right.
Yeah, I think it's a great slide. We could use it in our cardiovascular talk.
Yeah, I think that's the one that it needs to be on.
You can use it in a lot of different types of presentations. So what can you do as a patient? One is figure out and know your triggers and avoid them. Sounds pretty simple, but if there's hundreds of different things that can cause headaches, a lot of times, a lot of patients will not know what triggers their headaches. And that's why I asked every single one of them who doesn't really know their triggers to keep a headache calendar. So in this headache calendar, you write down the time, what you were doing when you had the headache, how bad it was, and as much information as you can. And then a lot of times you see a pattern to these headaches. So for example, sometimes you realize, you know, on a Monday, I always get headaches on Monday morning because on over the weekend I went to bed late every night, and on Sunday night I couldn't go to bed until 2 in the morning, but I had to wake up early in the morning, and that's why I got the headaches. Or I get my headaches at 2 o'clock in the afternoon every day, and those days are the days that I skip lunch. Or I get them after I have that Chinese food on so-and-so day. So this really, a lot of times, will shed some pattern to the headaches, and you figure out the triggers and you avoid them. Pretty simple. Irregular lifestyle. And I think basically the body and the brain has a rhythm. And when you interrupt this rhythm, it can cause headaches. So go to bed at the same time, wake up at the same time, eat regular meals, drink plenty of fluids, things like that. And there's also some vitamins and minerals that actually have been shown to prevent headaches in legitimate scientific studies. One is magnesium. I actually recommend it to all my patients because there's really no side effects. It doesn't interact with any other medication, and even if it doesn't do anything, it's not going to hurt anybody. But there is evidence that it does eliminate or decrease headaches. Coenzyme Q10 and riboflavin as well. There's some studies that showed that as well. So what about other treatments? What about non-medical or drug treatment? One is acupuncture, which I don't do, but my sister does. Cool compresses, relaxation therapy, or for really intractable headaches. Believe it or not, the FDA approved Botox injections for migraine prophylaxis. And those are patients who have 15 or more migraines a month, at least 4 hours long, and who failed medical treatment. And you inject, that I do actually, and you're supposed to inject 31 specific different parts of the head and neck at different quantities of Botox.
I always got younger.
Yeah, I guess that. If your headaches don't go away, you'll look younger.
You look great.
So in conclusion, migraine is not the only type of headache. There are hundreds of different types. There are hundreds of treatments, both medical and non-medical, and you can play an active role in preventing them. And many are benign, but some are life-threatening. Oh, and this is a nice quote I found by Sir Walter Osler, who founded Johns Hopkins University from down the street. And he says, the good physician treats the disease. The great physician treats the patient who has the disease. And that's my philosophy. And I think every patient is different, and every patient is has different needs and different comorbidities. And so I use medications to fit that patient's needs. Any questions?
Yeah. Back when there were a couple other drugs like Celebrex, I think it was Vioxx and Extra. One of them was advertising, hey, if you got a headache, it's probably from inflammation. This is the best anti-inflammatory. Take our pill, the headache will go away. To what degree were they right, and to what degree were they being really overboard?
Yeah. Well, what's interesting, there are many different drug categories that treat headaches who have completely different mechanisms. So there's probably many different causes for even a simple migraine headache might have many different mechanisms that cause it. And that's why many different types of drugs treat it. So one reason for migraine is inflammation. Another theory, I should say, is vasodilation of the vessels, meaning the vessels get a little bit bigger, and so they compress the different nerves in the brain. And the other type is cortical depolarization, which is basically this electrical activity in the brain. So, but we know the anti-steroidals do treat headaches, so I think it is valid. That theory is valid. And actually, for the hospital patients, a lot of times I do give them IV steroids to treat their, 10 out of 10 headaches.
I was going to ask you, but you've already said something. I was going to ask if you looked at electrical patterns.
Electrical pattern, yeah. There's definitely. Yeah, I mean, there's a lot of research that shows, and actually I was going to put a YouTube video here, but I just decided not to. I thought
You're not a YouTube fan, huh?
No, I am. I just thought it wasn't going to be as interesting talking about the
You could have
science
rickrolled
behind
us.
it.
That would have been fun.
The what?
You could have rickrolled us. That would have been fun.
Yeah. But
Great, I find someone who gets that.
I gotta look it up.
Oops.
But the thing is, I was telling Dr. Green before the lecture, we still don't exactly know what causes migraines. But the secondary headaches, for example, a brain tumor, we know why that causes a headache because there's a structure compressing on the nerves. But the migraine headache, we still don't know.
You know, one of the headaches is when you're sleeping, how do you know?
It wakes you up, it wakes you up.
Oh, okay.
Yeah.
So